Okay, and I think we're recording. So my name is Angela Hinkle, and I work in the Escambia County Extension Office. I'm with the Family and Consumer Sciences agents. Today we are getting started talking about exploring your health indicators and all of that, what that means for a lot of different things. And today we're going to be talking about diabetes and metabolic syndrome. So as we explore our health indicators, some other subjects that we have coming up in the future, we're going to talk about cholesterol, we're going to talk about inflammation and diseases, and kidneys and thyroid, and what those health indicators mean for those different areas. So we've got those three coming up May 11th, May 25th, and June 8th. So with the University of Florida IFAS Extension, whom we work with, we are partners in the communities to help really get information out to the public and to reach out our research-based information so that we can share that with all of you. In your Zoom session today, if you are not already aware of this, we'll just share this with you. If you hover over the bottom of your screen, you should see something that says chat. And if you click on that, you are able to either send a message or ask a question to just the panelists, or you can open it up for everyone and ask a question to all of the participants and the panelists, or make a comment if you would like to. And I will actually be watching that chat box as best as I can as we go through today's presentation. Just a disclaimer, very important. The information that we provide is for educational purposes only. And for any medical information, you need to talk with your medical provider. And we are not endorsing or selling anything in particular. This is just for educational purposes today. And today's webinar team, dun, da, da, we have Miss Marie Eric and Haley Corbett, Wendy Lynch and Wendy Dahl, and also Julie England, who helps put so many things together for us. It's awesome. And we have a special thank you to Daniela Rivero Mendoza, who has been nice enough to put the slides together for us for our presentations. So just a little to get us into today's presentation. We're going to be talking about diabetes, the diagnosis and the complications, the very important prevention, and living with diabetes. And then we're going to talk about metabolic syndrome, and we're going to talk about steps that we can take and how those numbers that we get, what we can do with those and what they mean with all of this. So I believe we are recording and we're ready to get started.
Sorry, didn't unmute. Sorry about that. So let's get started. This slide is really pretty busy. We've got a lot of things we're going to cover on here, but this really covers a lot of the generalities of diabetes. So let's start with the main types, and that includes type 1, which happens when your pancreas doesn't make insulin or makes very little insulin. Many times this is referred to as juvenile diabetes or insulin-dependent diabetes. And again, you know, this is because the pancreas is unable to produce insulin, or it doesn't produce enough. Rather, moving along to type 2 diabetes, the pancreas is able to secrete insulin into the bloodstream, but it's just not an adequate amount. So what insulin really does is normally it would be in the bloodstream and it would facilitate the glucose entering our cells for our body to use as fuel. Just that simple. But over time, in the long term, if the pancreas is not able to secrete enough and sugar builds in the bloodstream, this actually does harm the body. And that's type 2 diabetes. We're also going to touch on gestational diabetes. This is when a pregnant woman becomes diabetic who was not diabetic prior to her pregnancy. This is now a common test that is done during pregnancy. It's done generally anywhere between week 24 and 28. So we will touch just a little bit more on it in just a bit. So moving over to symptoms, there are many symptoms of elevated blood glucose levels. This includes dry mouth, excessive thirst, fruity breath, frequent urination. And that urination is because your body is trying to dump all of this excess sugar that's in the bloodstream. So your body's trying to excrete it. You may also be really fatigued, sleepy. You may experience weight loss. Some people, when their blood glucose levels get to a certain point, their bodies just don't cope very well any longer and they become disoriented. They can experience shortness of breath. They can have stomach pains. They can become physically ill. Generally, those high blood sugars, you're going to end up admitted to the hospital so that they can gain control and begin a treatment regimen. So that's just some of the symptoms. High blood glucose levels over time are really linked to a lot of different things. So if you're looking at your organs affected there, we're looking at cardiovascular diseases. That includes the heart. You think about hypertension. You think about atherosclerosis, which is the narrowing of blood vessels. We're looking at the eyes. We have blurred vision, but it also can affect vessels of the eye over a long period of time, and it can increase the risk for cataracts or glaucoma. If you look at the brain, it can accelerate memory loss. It's one of the things, I discussed confusion just a moment ago, but you have that rapid decline in thinking skills, and people struggle to figure out or do daily tasks. Some studies are now linking high blood glucose levels to many forms of dementia. So then we're going to move along and we will talk about some actions you can take to prevent diabetes. This includes maintaining that healthy weight, really consuming a balanced diet, and staying active. We will touch on some treatments. Diabetes is very individualized, and that is something between the patient and the treating physician. But I want to stress this. As the patient or a caregiver of a diabetic, the more you educate yourself, it can ease the transition to an overall management of the diagnosis. It also should be noted that you can have a predisposition to developing diabetes. It does run in families. Next slide, please, Wendy. All right, so let's kind of talk about the diagnosis. If a person has a slightly elevated blood glucose level during just routine labs, the physician's going to explore this one of three ways. Generally, they would have the patient in one option, go home with the glucometer and have them check daily fasting blood sugars. And then they might also ask them randomly to check a blood glucose level 2 hours after a meal, because they want to see if the patient is excreting enough insulin to manage the sugar in the bloodstream after that meal. The second option they might go for is they would order what is called a hemoglobin A1C, or glycosylated hemoglobin A1C. Cannot speak today. I apologize. This test actually determines the average of a person's blood glucose over a long period of time, generally 2 to 3 months, and that just depends on the lab, the brand of test that they use. This is a common test that is ordered on diagnosed diabetics, and it helps to guide their medical regimen. So it determines if they are adequately controlling their blood sugars with their current medicines and diet or lifestyle. So the third option is the oral glucose tolerance test. And as we said previously, it is administered to pregnant women now between weeks 24 and 28 of gestation, but it's not exclusive to pregnancy. There are other indicators for this test, and we'll explore how that test is administered in just a few minutes. Next slide, please. So here we have two different arrows. The one on the left is your fasting blood sugar, and it demonstrates the normal, the pre-diabetic and diabetic levels. And the other is the hemoglobin A1C. And it should be noted that any lab work, it's always best if you can fast, and it just helps to make things a lot more accurate. So what does all this mean? So the parameters on the left, as I said, are your glucose levels. So if you are going to be normal, then it's going to be 100 milligrams per deciliter or less. So, that's wonderful if that's where you turn out. So prediabetes is now determined between 100 and 125 milligrams per deciliter. And then if you're diabetic, it's going to be 126 milligrams or higher. And then over on the right-hand side, if the A1C, the hemoglobin A1C comes back at 5.7 or less, then you're normal. You're doing great. But if you hit the 5.7 to 6.4 range, you're going to be what they are calling now pre-diabetic. And so you would then be looking at maybe getting some education to see what you can do. If you're a diabetic, pretty much it's going to be 6.5% or higher, and that's how they're going to diagnose you. There is also what they call a random plasma sugar test, and this test just can be done at any time. And if your level comes back at 200 milligrams per deciliter or higher, then you are diabetic. I want you to also understand that if you go into a laboratory and they check your blood and they run a chemistry panel, and that includes a fasting glucose, if that level comes back abnormal, it is protocol that they repeat those levels. So they will repeat for accuracy. If they have any doubt that it's not accurate, they will have you come back in for a redraw. Next slide, please. All right, this is the oral glucose tolerance test. So this is done in a lab or at your physician's office, and it requires the patient to fast for a minimum of 8 hours. Then you would present to the lab, and they would check an initial blood glucose just to see where it is. Then they would have this patient consume a special 8-ounce cocktail, and this cocktail can contain up to 75 grams of glucose. This amount is sometimes adjusted, and it can be age adjusted and or weight adjusted. And they will have you drink that cocktail. Then they will monitor you for 2 hours. And at the end of those 2 hours, they will check another blood glucose level. If that blood glucose level is 140 milligrams per deciliter or less, then you're considered normal. 141 to 199 is pre-diabetic, and over 200 milligrams per deciliter is considered a diagnosis of diabetes. Generally, if this test is abnormal, they're going to go ahead and order that hemoglobin A1C. All right, next slide, please.
All right, how to find my unmute. So with diabetes prevention, there's some things that you can do. So first and foremost, you can increase your daily physical activity. So aiming for that 150 minutes of moderate intensity activity on most days of the week. Your risk factor increases for diabetes if you're not getting at least 3 days. Also incorporating a healthy diet. And we know choosing some non-starchy veggies, If you're not sure what those are, go to the American Diabetes Association website and just put in the search bar non-starchy veggies, and they'll have a great list for you. Also, of course, choosing whole grains, fruits, lean meats, just eating an overall healthy diet. Another option too is to join a lifestyle change program. So the CDC has the Prevent Type 2 Diabetes program, as well as a lot of our extension offices have lifestyle change programs that do focus on increasing daily activity, stress management, eating a healthy diet. And let's say if you're not exactly sure if you're pre-diabetic or if you're in that range, one way to find out is take that type 2 diabetes risk test. And so that can be found on the diabetes.org/risk-test. And then again, you can also contact your local extension office, or to find a CDC approved program, you can go to that CDC website. So if you're living with diabetes, and I know Maria alluded to a lot of this already, reasons to check your blood sugar to delay some of those long-term impacts. She mentioned about increased risk of dementia, but also vision loss and heart disease, kidney disease, as well as nerve and foot damage. You might have heard of neuropathy, so that's where that would fall in. Other symptoms that you may not always pay attention to is for ketoacidosis and ketones, feeling that constantly being tired, just fatigue, a fruity odor on the breath, also confusion. Maybe you have difficulty breathing, that dry or flushed skin, also poor wound healing and nausea. So when should you check? Well, as Maria mentioned this early also about being in touch with your healthcare team, your physicians, finding out what schedule is going to work best for you. Just some general guidelines to follow is when you wake up, before your meal, 2 hours after, and also at bedtime. There's some other suggestions on the bottom of the screen, but first and foremost, check with your healthcare provider to see what's going to be your best schedule.
So now we're going to talk about actually measuring your blood sugar. So the typical way that you would measure your blood sugar once you've been diagnosed with diabetes is through a glucometer. A glucometer can either now be the traditional one that we see here, where it's a little one, you get the drip of blood from your finger and it tells you your sugar pretty instantly then. Or they have now come out with other options, such as the continuous glucose monitoring, that are little systems that you put in different places on your body, and they remain there for a period of time determined by each individual manufacturer. And you can instantly just touch yourself onto it and it gives you your blood sugar reading right then. Hence why it's called continuous monitoring. So with this though, you want to remember that it's important to figure out which one works best for you. Just because it's new doesn't necessarily mean it's going to be the one for you. Exciting can be new, but if you're used to the traditional, you may want to stick to that. Or your physician may tell you that you need to stick to the more traditional because maybe you need to do it more often or things like that. So this is definitely something that you would want to talk to your physician about, but know there are options out there for you. The next part we're going to talk about is, and Maria alluded to this earlier too, so about another way to measure your blood sugar, which is through your A1C. And this is typically done more by your doctor than you at home. And so you're definitely going to want to work with your physician when you do this. The CDC recommends that you aim for an A1C 7% or less. However, everybody needs to remember that everybody is different. We are all not the same. We have different lifestyles. We have different other conditions. We are different ages. I mean, all those kind of things play into any type of condition that you have. So you have to think about those things when you're dealing with your blood sugar and dealing with having a life of diabetes. So depending on your situation, you're going to want to make sure that you always consult your physician about any decisions around your health. when it comes to diabetes, depending on where you're at in it, sometimes you will just stick to your family physician or a nurse practitioner that you see regularly, and they'll help manage your diabetes. Other times, you may be referred to an internal medicine doctor or an endocrinologist because you may need some more specialized treatment for you. An internal medicine doctor specializes in adult care with focus on managing patients with multiple medical conditions. So that's, if you have a bunch going on, that may be why they refer you there. And an endocrinologist, I'm sorry, my tongue is getting tied too, are qualified to treat conditions like diabetes, thyroid disease, growth issues, metabolic disorders, some cancers, gland issues. They have a lot of things that they can do, but diabetes is the one we're focusing on here. So why would you be referred to an endocrinologist? Just a sec. So an endocrinologist may be referred because your PCP thinks that's a better way for you to be evaluated. So I'm very sorry. I picked up some kind of little voice cough thing this weekend, and it has drove me crazy. So I apologize. Just a second. All right. So another reason that you might need to go to an endocrinologist could be if you're having complications or difficulties managing your diabetes with your primary care, that may send you to the specialist. Also, if conventional treatment methods aren't working, or if you're interested in a different type of method, whether it's insulin dependent, you're taking a lot of insulin, or even an insulin pump, those can be things that refer you to an endocrinologist instead of just your primary care physician. So these are the targets for when you have diabetes and you're taking your blood sugar on a regular basis. So this is that glucose monitoring. However, as I've already stated, this is definitely something that you want to talk to your physician about because everybody is different. So these are the standards, but you may have different standards depending on where you're at in your life and your lifestyle and your health. So definitely make sure that you always talk to your physician about these. But there's things to remember too that when it comes to helping to live with our diabetes, your physician may refer you to a registered dietitian or to a healthcare provider to help you with your diet or your daily intake of nutrition and those kind of things. And the reason for that is they want to make sure that you're doing the best thing you can to manage your diabetes. But one thing that you need to remember as the patient is that you want to make sure that you work with whoever that is and make sure that the goals that you're setting with them are goals that need to be met, but also that they're realistic. You have to be an advocate for yourself and make sure that they give you this goal, but it needs to be in a time frame that you can do. Now, don't get me wrong. Sometimes they're going to push you because you need to get to that area, but it's a good idea to still be realistic because there's no reason that you should ever feel like it's too far or feel overwhelmed because a lot of times that'll lead us to go backwards instead of forward. So always make sure that you talk to your physician and work with them to make sure that you have the best plan for you. So another very important thing when it comes to living with diabetes is actually tracking your monitoring. Okay. So, especially I'll say with the continuous glucose monitoring, I could probably say that it would be really easy to just touch my cell phone up to my arm if that's where I have it located, read the sugar and keep going with life and not even think anything else about it. However, it is very important that you actually write down those results. It's going to help you to know what is affecting your sugars, what kind of things you can do to help reduce them, as well as your physician. So you can take something in so they can actually see how your body's reacting, not just assume. So don't forget to always write it down. There's two different methods, as you can see on here. There's the traditional method of simply writing it down. So you can get a notebook and create your own notebook that's just dedicated to writing down your sugars. Or as you see here, there are tons of forms that you can find online. Your physician might give you one that you can use to track your own blood sugars. The idea though is to get it down. They also, because technology is so advanced now, have apps that you can use. And those are a couple of these symbols on the side here. They're just different ones ones that you could potentially use just to track your glucose. Now, I will tell you the cool thing about the apps to me is the fact that not only can you track your glucose on them, you can track your food intake and everything else. Now, don't get me wrong, you can do that on paper, but people just don't tend to do that as easily on paper. But in the app, they always seem to make it more fun. So if you're more technology, that might be your way to go. If not, make sure that you write it down either way.
So moving on to hypoglycemic events. A new diabetic should actually carry a glucometer with them or have the continuous monitoring device to allow for glucose levels to be checked in the event that they may actually experience some of the symptoms of hypoglycemia, but sometimes that can be also confused with hyperglycemia, which is high blood glucose levels. So, for instance, fatigue, sleepiness, nausea, blurred vision, sometimes you don't know which way your sugar is going. So that's why you really need to actually have access to be able to check it. So once you have checked your sugar and you realize that your sugar is low, then you would actually need to consume something. So low blood sugar is actually when your sugar has dropped below 70 milligrams per deciliter. So carrying things like glucose tablets are really quick for a diabetic to consume for a quick response to that activity. So next slide, please. So again, that low blood sugar is actually defined as 55 to 69 milligrams per deciliter. If you experience a low blood sugar event, they have what's called the 15-15 rule. So they want you to consume 15 grams of carbohydrate, quick acting, i.e. maybe a glucose tablet. So that's about 60 calories. And then you wait 15 minutes and then you repeat that glucose test again. If it's still below the 70 milligrams per deciliter, then you would repeat that process. So 15 grams of carbohydrates should actually raise your blood glucose 50 to 60 milligrams per deciliter in 10 to 15 minutes. So that's why they're saying it's a 15-15 rule. So you take the 15 grams of the carbohydrate and then you wait 15 minutes. They also want you to, once you get your blood sugar up above that 70 milligrams per deciliter, to consume a nutritious meal or a snack to completely aid with that recovery. So that might be apple with some peanut butter to kind of help level off that spike in that sugar, or if you go and sit down and have a meal. But a lot of these, the shakiness and the sweating are probably two of the most common low blood sugar symptoms you will see. Next slide, please. So this is metabolic syndrome. And this little cluster here is a group of disorders. So when a patient goes into the doctor and the doctor starts looking at some of their diagnoses and they see that they have 3 or more of these on the screen, the abdominal obesity, high triglycerides, which is actually a fat that flows through your blood. You have that low HDL, which is the high density lipoprotein, cholesterol, which is your good cholesterol. You have high blood sugar or maybe high blood pressure. So I'm going to just share this little anecdote with you. I once worked with a cardiologist, and he actually told patients about what he called the fatal 5. And he referred to diabetes. He referred to high blood pressure, high cholesterol, obesity, and then his last one was tobacco usage. And his mantra was always this to all of our patients: choose one and work on it, because the others will follow. So if you choose to work on your blood sugar and you adjust your diet and you exercise or do other things to adopt a better lifestyle to address your high blood sugar, by default, you may lose weight, which would contribute to your lessening your abdominal obesity if that's a problem you have. It can aid with your blood pressure. It can raise your HDL, which exercise is really a good way of doing that. So, as he said, if you pick one thing, a lot of times the others will follow. So, that's just a brief little overview on metabolic syndrome. Next slide, please. So again, going back over this, the abdominal obesity is women with a waist circumference of 35 inches or greater, and then men is 40 inches or greater. The high triglyceride level, if you have just your lab work done and it's 150 milligrams per deciliter or higher, then that's elevated. The low HDL, which is your good cholesterol, for men, if it's 40 milligrams per deciliter or less, and women, if it's 50 milligrams per deciliter or less. Again, we've covered the fasting blood sugars, and then obviously the high blood pressure. So those ranges have actually changed. Now it's 130 millimeters of mercury for your diastolic. So that's your top number. I'm sorry, your systolic. Your diastolic is your bottom number, and if it's 85 millimeters of mercury or greater. So we want it to be less than 130 over 85. So also, I'm going to go ahead and give you a plug. Next time on May 11th, we are going to talk more about cholesterol, and we will really be exploring all of those things. Next slide, please. So if you look at this, steps you can take, we talked about lifestyle, the balanced diet, being physically active, the healthy weight, living with diabetes. Think about it. If you actually have diabetes, they have diabetes self-management education and support services. The ABCs of your diabetes, your A1C, what your blood pressure is, your cholesterol, and then smoking is the S on the end. So coping skills, there are a lot of different things that you can do. Those coping skills are actually taught a lot of times in those self-management courses, or even just a 1 or 2 visits to a diabetic educator can really help you along the way. They can answer so many questions for you. So just remember that you need to ask your healthcare team, what your A1C goal is. Know that smoking actually does raise your blood sugar. Ask for help. There are a lot of different ways that you can do things. There are so many different things that are now available. Meet with your healthcare provider at least twice a year to stay on top of your management. Ask questions, advocate for yourself. Do that one thing, choose one thing you really want to focus on that you feel like you can easily manage. And then once you've managed that pretty well, look at your other things that you feel like you need to look at and, advocate for yourself. It makes a huge difference. Next slide, please. So going back to the very beginning, we want you to know your numbers. This aids greatly with self-care and disease management. You are your absolute best advocate. So maintain your appointments and have that open dialogue with your physician. And the last slide, please. There will actually be a short evaluation, and we would love for you all to fill that out. It just helps us